Hey parents, my name is Dr. Chris Bowman. Thank you so much for joining me on this webinar today. We're going to be talking all about ear infections. And this is honestly one of the topics that I am most passionate about. I've probably seen more ear infection patients than any other symptom that a kid can have because they're so common. And they're actually one of the easiest things to take care of. So if you're on this webinar because you're at your wit's end, your kids that have ear infection after ear infection, you're tired of the antibiotics, you don't want to do tube surgery, you feel bad for your kid waking up in the middle of the night screaming and there's really nothing that you can do, and you want to figure out what you can do to help your kid's immune system stay strong so that they don't get any ear infections again. If you've been in my office before, or if you listen to any other of my webinars, I most likely will say something like common is not normal. Well, 80% of children have at least one ear infection by the time they're at least 3 years old. So ear infections are definitely common, but they're definitely not normal. Neither of my kids have had an ear infection, and I've had multiple patients that I've been seeing since they're in the womb, and they have never had an ear infection, and they're 2 and 3 years old now. Having an ear infection is pretty much the number one reason why a parent takes their kid to the pediatrician. I'm really passionate about seeing kids with ear infections because most of the time it's not a one-time thing. You don't get one ear infection, you never get one the rest of your life. Most of the time kids are getting 1, 2, 3, 4, 5, and most of the time they're getting antibiotics after every single time. And so we know that there's other effects that happen. The antibiotics don't just attack the bacteria in the ear, but they go everywhere. And so with all the information about the gut microbiome, probiotics and all that stuff, that antibiotics are not good to continue to give the system, especially when they're a really, really young kid. Most of the explanation that the pediatricians will give their parents is, which I'm sure you've heard, is that the eustachian tube is a little bit flatter than it is when you're an adult. And so as you age, you'll grow out of ear infections. And I hate to break it to you, but actually gravity has little to no influence on the drainage of the ear. It's actually a muscle, which we'll go over in a little bit, that pulls the fluid down rather than gravity just drip draining it down into the lymph nodes. So the other common signs, or the most common signs that your kid has an ear infection, sometimes it might be during the time of teething, because teething produces extra fluid, maybe even a fever, and it brings excess fluid, to the sinus system, which is linked to your ears. The cold season, congestion, it's not draining like it should be. Fevers, high spikes, low valleys, fever or low grade consistent fever, and then also that classic, tugging on the ear. Some kids get them, that swim a lot. Their ear isn't able to drain the way it's supposed to. Some kids get them when they get sick. Some kids get them when they're teething. So they can happen kind of at different stages throughout life. And what I really wanted to go with you, this is one of my favorite slides, is the sequence of ear infections. So let's start in the beginning. What an ear infection is an accumulation of fluid within the ear. The ear gets overwhelmed and it can't drain, and so it starts to get infected. Okay, when the fluid gets infected, that's when it gets red and pussy. So when you look into the ear, you see it, gets all red, sometimes pus and that sort of thing, and that's when it really, really, really starts to hurt. So after you've had multiple ear infections, the antibiotics aren't working. Typically, they'll recommend the tubes. Now, the tube surgery is a pretty quick surgery, but it's pretty intense. You can look up the tube surgery on YouTube. I used to show it at one of my seminars, and they literally slice open the eardrum, put the tube in there, and then hope it heals up. These ear tubes also, how they drain is they change the pressure in the ear, okay? And that causes, instead of, like I talked about, little drops of fluid being drained at a time down the throat, it sends a whole big gulp or bolus of fluid that goes down, and that starts to overwhelm the tonsils and the adenoids. So a lot of the times these kids that get tubes start to get a lot of strep throat, swollen adenoids, and large tonsils. And so the next thing is to take those out, right? Well, after we take those out, a lot of the times we start to have snoring. A lot of times we start to develop different allergies, more sore throats. And because now the fluid is going all the way down, it's bypassing those immune system organs. It goes all the way down into the chest. And so now kids start to develop allergies and asthma and chronic coughs, because instead of taking care of the infection where it started, we're driving the infection deeper and deeper and deeper into the body. And so you can see how this kind of initiates a sequence of being dependent on medical care, from antibiotics to a surgery to a inhaler for asthma to Claritin for allergies. It's just one thing after another, and nothing is getting after the root cause. It's all just kind of putting out the different fires that medicine is causing. Now you might be wondering, how would an ear infection, happen? And I actually have a little spine model here that I wanted to, an ear model that I wanted to show you. So this is obviously the outer ear, goes into the middle ear, and then this is the eustachian tube that we talked about, where we'd have normal drainage. Okay, what happens in an ear infection is this muscle. It's called the TVP muscle, tensor veli palantini. It's a muscle that is innervated by a nerve, which starts in your upper neck. Okay, if your upper neck gets stressed, which we'll talk about how that might happen in a kid in a second, that muscle is going to spasm. Just like if a nerve in your low back spasms or a nerve in your shoulder spasms, you feel that knot there, right? When this muscle spasms, the tube that goes around the eustachian tube is a tubular muscle, which means that the muscle, instead of being open and slowly closing like this to squeeze fluid out, it's going to spasm and clamp down. And because the fluid isn't draining, that's what causes the accumulation of fluid in the middle ear. And why we do tubes is because that punctures the eardrum, which, like I said, depressurizes the middle ear and sends a whole bolus of fluid down. And why an antibiotic might not take care of the problem at its root, why it might keep coming back, because the antibiotic will destroy all the bacteria that's inflaming the area. But if the fluid is still there, then the bacteria are always going to come back. Okay, and so now we want to talk about what can we do to help this muscle relax? What can we do to help make sure that this muscle is doing proper drainage rather than killing the bacteria or depressurizing the middle ear? Well, we talked about if that nerve is stressed, the muscle is going to be stressed. So how is the nerve stressed? Well, one of the main sources is actually a very stressful or traumatic labor and delivery process, namely C-section, forceps, or vacuum birth. That puts a lot of stress right at the base of the skull, where we talk about that nerve starts and go all the way to the middle ear. Another one would be nursing issues. If they have a side preference, one side or the other, so they're always laying one way. Another symptom that you might start to see along with ear infections and things like torticollis and cranial shape, which if you struggle with torticollis or cranial shape, I also have a webinar on that. And the baby starts to become really, really stressed. It changes the immune system. If we're always giving antibiotics that's affecting the digestive system, 70 to 80% of the immune cells are located within the digestive system. So if we're constantly sterilizing the gut, depleting the microbiome, that's going to reduce the immune system's awareness of what's going on the outside, which causes it to hyper respond to anything that comes in. That looks like increased inflammation. Increased inflammation is the kind of the root cause of almost every chronic disease known to man, right? And so the contributing factors to having an ear infection, like we talked about, are teething, and then the main thing, congestion, cold. But the main thing, in my opinion, is the stress that most kids go under through the birth process, going through the birth canal. Now, how does chiropractic care help? What we do is we look at, is there stress in the nervous system that could be causing this muscle to tense up? How we look for that is, one, I start to feel the spine. I start to feel the tone. I start to feel the movement very, very gently in kids, of course. And we also do, depending on the age, something called infrared thermography, which looks like inflammation going all the way up and down the spine. Inflammation is, like I said, the source of stress. So if inflammation is at a particular area in the spine, we know that that is the source of stress. That's the stress trigger. In older kids, we also do something called surface EMG, which measures muscle tone and tension. And if we're able to know where the muscles are tight and where the inflammation is, we can pinpoint where the problem is and how bad it is. And then we can put a plan together to know, how do we know that the stress is out of the system and the ear infection won't come back? The adjustments are very, very gentle. Kids usually laugh throughout the course of their whole adjustment because it's silly, it feels fun, and we call it a popcorn visit. And it actually feels really, really good. Some side effects of chiropractic care include better sleep, include better range of motion, include less fussiness. So as you can see, they're not necessarily side effects as much as they are side benefits. So what I really, really recommend, if your kid does have chronic ear infections, if your kid does have torticollis or going through teething, or even when they're sick, to prevent ear infections to come, I highly recommend that we get your kid's nervous system checked, also especially if they had a traumatic birth process. So that way we can look at the problem at the root cause, and we prevent problems from coming in the future and free them from a possible dependence of, on the medical system for medications and for therapies. If this information really resonated with you, I highly encourage you to schedule your consultation with me. So you can call or text us today, and we'll get back to you as quick as we can because we know this is important to you. We know that we don't want our kids to suffer any more than they have to. And also, if you know anybody that has a kid that's struggling with ear infections, please, please, please share this information with them, because this isn't everyday advice. This is somebody that has seen time and time and again kids with ear infections heal. You can just go ahead and check it out on Facebook or Yelp. There's so many reviews of kids being rid of ear infections forever. One of my favorite stories was there's this little girl, and she came to see me, and she couldn't swim in the summer. Now in Southern California, especially where we live, not swimming in the summer is the worst thing that could happen to you, because it gets super, super hot. She'd have to wear those wax plugs going in there. She'd have to wear them in the shower. She'd have to wear them in the bath. She'd also struggled with immune issues, so she started to get allergies, and she also started to have some behavioral issues. We started getting her adjusted. We did her scan, and we found out that there was stress, high amounts of stress right at the base of her skull. We started getting her adjusted, and lo and behold, she went swimming, and the ear infection didn't come. She took a shower, the ear infection didn't come, and they haven't come since their first or second adjustment. And almost every single kid that I see, it's the exact same story. I saw another little baby, maybe 4 or 5 months old, just last week, and they had like pus coming out, and the pediatrician was like, it's normal, and I'm like, that is not normal, but it's probably common. And so we got him adjusted, and within just a couple of days, everything started to disappear. The fussiness went away, the pussiness went away, and overall, he became a much happier baby. So I look forward to seeing you and your family in the office. Thank you so much for watching.